thank you so much, Al Moore. Welcome into another edition of Comcast Citywide TV presents A Conversation With. I'm Tom Pace, your host. I also do a radio show on The Promise, 90.7 FM, every Monday through Friday, 5 to 6 o'clock. But today, inside the Comcast Citywide TV studios, with our special guest, a conversation with, she's the CEO, the head person in charge of Proactive Nursing Solutions, and a registered nurse, Miss Jennifer Kimball. And Jennifer, welcome in.
Welcome you.
In. Hey, tell me about this. You've got this organization that you founded. I mean, this was your baby, so to speak, Proactive Nursing Solutions. How long has that been around now?
Created it and established it in 2010, so we're going on 6 years.
Going on 6 years. Now, first off, you've got to have a passion for it, B, a reason to do it when it comes to nursing. Are you a registered nurse?
Yes.
Where are some of your credentials and in what areas of nursing?
My background is primarily in rehab nursing, acute hospital-based rehab nursing, as well as psych nursing. I do have a Master of Education in Psychological Services as well. Also did quite a bit of work in hospice, and as well I was the director of nursing at a couple of the nursing homes here in town. Mm-hmm. So primarily my focus has been in geriatric care on many different levels.
Okay, so let me get this straight. You're qualified in various formats of nursing and nurse care, and yet Proactive Nursing Solutions seemed to be a fit for you when it came to what, geriatric nursing? Mm-hmm. Tell me about that.
I've always had a passion for the geriatric crowd.
Which, let's get it straight as to when we refer to geriatrics, the age group that you're involving.
We would probably state that, to make it simple, as Medicare age.
So, 60,
so it's not
65
necessarily,
and older.
Yeah, somewhere around there.
Okay.
There are also situations where somebody may be disabled at an earlier age, and we consider them as well.
All right. So the deal is that they need specialized care and many times unable to get from point A to point B for appointments and or have their medication brought to them. Is that part of your service? Help us with that.
We have, we provide care management services, nursing care management, which is a little bit different from home health. We do not provide any skilled services that home health would provide. And those are Medicare-funded services with home health. We're a private pay company that provides services for pretty much everything that home health doesn't do.
Give us an example of some of the things that you would provide that maybe someone's watching this right now and saying, oh, I did not know about this. Help me.
Okay. I like to use the example of, more people trying to stay at home instead of going to any facilities, any long-term care facilities, assisted living. Not that there's anything wrong with those, but so many people want to be comfortable at home. There may be one or two deficits in their life where there's nobody who can fill those needs. Maybe medication is a problem, getting them sorted out because they're on 15 medications, which is not unusual at all. But setting up something where it's foolproof, where they can take those medicines reliably, maybe with a once a month or 2 times a month visit from the nurse. If we get them a system in place and ensure that things are going okay, they're doing what they're supposed to do according to the doctor. That's kind of the goal. We're trying to keep them out of the hospital where it could be prevented. Could be medicine related. It could be
therapy
doctor's
related?
Appointments. Well, therapy generally goes back to skilled care.
Sure, right.
Which would be what home health would provide.
But would you take them to an appointment?
We don't actually transport. However, we do accompany people to appointments, often doctor's appointments mainly.
That's what I'm getting at.
Because a big part of people not following directions are not understanding them. So when you walk out of your doctor's office, have you understood everything that he said and you've remembered it?
Not always. I'm trying to read what he gave me and then assimilate it.
Probably not. Chances are people walk out. Many times they haven't even heard and understood when they were in the office, because maybe the doctor had an accent and their hard of hearing, the patient's hard of hearing. That combination is very common, and they're confused. They have no idea what just took place in that doctor's office, and they're too ashamed to admit it. They won't say anything. They won't ask questions.
So what do you do?
So with a nurse there, we know how to communicate information, how to communicate information when the patient leaves the office, how to follow through making sure that information is followed, the directions are followed, whether it's new medications, follow-up appointments, if they need a referral to a specialist. It's one way to make sure that compliance is there. So that every step is taken to keep them healthy. Many times they walk out, and it was kind of pointless for them to go, because when they get out, they're lost. They have no idea what's gone on.
And you see, ladies and gentlemen, this is the reason why we have Miss Jennifer Kimball here in the studio today. Because let's face it, the largest growth in our population are the baby boomers, Group 1 and Group 2. And many times, all of us have to go for that relatively, sometimes kind of kicking and screaming checkup. And then after we've been told all this, we're doing real good just to remember everything that's written down on 2 or 3 pages. So instead of doing that, what you can do is what Ms. Kimball has done, create a database and a regimen for those that are now being cared for by a doctor, and come to their homes on a regular basis and then follow that regimen. Would that be fair?
That's part of it.
Yes. And is there
it.
something else that's more important that everybody needs to know, Jennifer?
Well, when it comes to nursing, we also do some assessments in the home. When we know somebody, we can pretty well walk in with education and experience. We can walk in and tell if there's something different. And the key to getting treatment earlier is to detect something earlier. If there's maybe a family member, adult children, loved ones, whomever the responsible party or interested parties would be, maybe they're out of town, maybe they don't live near enough that they can check on this person regularly. With somebody who knows the baseline for that person, when you go in and you see something different, you're more apt to direct them to treatment earlier, so that instead of a 20-day hospital stay for an 80-year-old, which is never good,
no.
Maybe it means a 2-day hospital stay, if that. Maybe you catch it, get them to the doctor, get them their medicine, and they're
back home.
They miss that hospital stay that they would have had for pneumonia or whatever it might be. So the key is to catch things early. And for those that have chronic illnesses, pneumonias, COPD, diabetes, dementia, things like that, the key to that is making sure that their chronic illnesses are being managed efficiently. They're doing everything that they can to try to stay out of the hospital. There's kind of a revolving door on the emergency room for those with chronic illnesses. And so we really try to keep a tight rein on that so that people don't wind up in the hospital getting sicker.
Sure. And if Proactive Nursing Solutions, if one was interested and one said, oh, I'd like to know more, is there a fee to come out and do an assessment or what?
No, we can come out and do an assessment. We consult for, care in the home, such as we've talked about. We also consult for possible placement into facilities. Some people don't know how to go about doing that or what questions to ask. They may not know the differences in state surveys for long-term care facilities. They don't know how to interpret what they're being told by facilities. And sometimes they just simply need assistance, some guidance. It's amazing how many people don't even understand that when you go to a long-term care facility, Medicare doesn't pay for that.
What? Medicare doesn't pay for LTACs, long-term
They don't pay
care,
for any,
acute
they call
care?
it custodial care. So when somebody leaves that skilled care in a nursing home facility and they go to custodial care, meaning they're no longer receiving skilled services, Medicare doesn't cover that. And so it comes as a shock to most people until they are actively trying to get somebody into a facility. That's a huge surprise to most people.
And so what you would do, you could come in and do an assessment at no cost, and then recommend, well, these are the various facilities. This is
different options.
And this is what we can do to assist you in further that. And then at that point, you would lay out all the various plans that you would offer, whether it's a month, every month, or every 2 weeks,
Sure.
or what.
If they're staying at home,
Yes.
Options for what you can do to keep them at home, or yes, helping them transition into a different facility like assisted living, if that's possible. And generally, we have a pretty good idea of what they might qualify for, whereas they're kind of lost. And with them being lost, they end up spending a lot of time calling facilities needlessly. So we can kind of be a time saver sometimes. We also do a little education sometimes for caregivers if they need it, especially if they're new caregivers, whether they be family members or people that they've hired that they just want to make sure they're educated on how to take care of their patients. So we do a little bit of whatever needs to be done. We're trying to fill those needs.
What an amazing job. I mean, I would liken it unto buying a car. I know enough to turn the key in, start it up, and reverse and all of that. But when it comes to all the add-ons and things of this nature that would help me, I need somebody to sit there and kind of give me a tutorial.
Right.
So that's kind of where we are. Now listen, we've been through 12 minutes like this. We're getting ready to go to a break, and it's a 2-minute break. But when we come back, we're going to talk more about geriatric nursing, because this is wide open, ladies and gentlemen. Geriatric nursing is affecting all of us. And if you are, denial is not just a river in Egypt. We are all going to get there. So it's good to have those that are skilled to interpret all the laws and all the various treatments that we would have in being cared for. And we're also going to talk about those that don't have relatives, that are by themselves. So don't go away. It's Comcast Citywide TV presents Conversation with Jennifer Kimball. She's a registered nurse and the founder and the CEO of Proactive Nursing Solutions. I'm Tom Pace. In 2 minutes, we'll be right back. Don't go away.
Well, I got wheels, put it in drive. Let's go for a ride. Down the road alive to one lane. You find it's one of a kind. Don't know when it's coming round, but we're not backing down. Still want to touch the feel, the fabric of our lives. The touch, the feel of cotton, the fabric of my life.
Since 1970, Christian Service has helped the less fortunate within our community. Keeping with the vision of Sister Margaret, we serve 2 hot meals a day, 364 days a year. Now, feeding our community has become an even greater challenge, and Christian Service is in need of your help. Partner with us by making a donation that will allow Christian Service to continue treating our less fortunate with dignity, love, and hope. Call us today at 221-4857.
As an American, it's hard to hear that we have a serious hunger issue in our country. And as a parent, it's even harder to hear that 1 in 5 of our kids struggles with hunger, especially when billions of pounds of good food are wasted every year. Feeding America is a nationwide network of food banks that helps provide billions of meals to families in need right in your community. Visit feedingamerica.org to support Feeding America and your local food bank. Together we can solve hunger. Together, we're Feeding America.
Oh, look, a redhead. Staring contest. You still got it. I know. Come alive with the forest. The dad was cute.
You were looking right at us.
Visit discovertheforest.org to find a forest near you.
Hey, Al Moore just said, you're back, and so we are. And this is part 2 of a conversation with Jennifer Kimball. She's a registered nurse with various levels of skills, and also the founder and the CEO of Proactive Nursing Solutions. And one of the things now going on their 6th year in service, is it just a Shreveport-based company, or do you serve outside the Shreveport area?
We are actually licensed in Louisiana, Texas, and Florida. However, some of our services are local to this area, the Shreveport-Bossier area, just because we are working on getting more help in all the states. We do have some contracts that send us out to the other states, and we have nurses there placed for those contracts. But we kind of have some special services here in Shreveport-Bossier that are really privy to Shreveport-Bossier for right now.
And the good news is you're saying Shreveport-Bossier, so albeit it might be located in Shreveport, your headquarters, you do cover the Shreveport-Bossier environs, and also over into Texas, East Texas a little bit?
Yes. We have some contracts that feed into Texas and into Florida. So, but right now we just have some services, private services that are local to this area until we can expand even further. But it's been a fast growth.
Well, congratulations, and I think that's something that everybody wants to see, is an entrepreneur, a young lady that has taken the nursing skills and the stethoscope by the horns and said, I can do this. Why? What was the epiphany that said to Jennifer Kimball, you should do this? Was there a moment, an aha moment that occurred?
There were several, I think. I myself have been in healthcare for close to 30 years. So it's been a long
time. You do
time.
not look it, but go
Thank
ahead.
you. It's been close to 30 years. And all along the way, even while I was getting my education and working in different places, I kept seeing who was falling between the cracks. And I give one example that I give frequently. I can remember working hospice and hearing a story of a woman who, at that point, qualified for hospice. And what had happened, she lived by herself, and she had not been taking her blood pressure medicine. It was just as simple as that. So she had a stroke while she was in the tub. So by the time someone found her a couple of days later, because she was living alone and nobody was frequently checking on her, she was in pretty bad shape, being in the tub for 2 days and considering...
In the tub for 2 days?
Yes.
And nobody checked on her?
No.
Did she have any relatives, probably?
There were relatives, yes, but they weren't local. So there was nobody just regularly calling or checking on her. And I can remember the questions, if we would have just known. And this one kind of takes it to a different level, because it starts with, if we would have just known that she wasn't taking her blood pressure medicine. And then it leads on to, if we would have just known that she was hurt or that she was laying in a tub. You know, there's so many steps to it. I wish I would have just known then. Because, you know, if somebody would have found her right after it happened or would have known, there's a good chance that things would be much different.
You could have resolved it in a more acceptable way to where she could still be there, but no.
And backing up, even, you know, to the point she wasn't taking her medicine, if somebody would have been there to know that, and an adult child may have walked in every day and not known it. If you don't know what you're looking for, you're not going to find it necessarily. So there were many steps in that process that just scream out to me, who would you have called? Who would you have employed to do that? And there was no services available. There was nowhere to call. So I give that example because it's pretty obvious.
It was like the aha moment.
Yes, but there were many times I heard those stories and it screamed out, there needs to be somebody.
Well, whatever possessed you to take the mantle there?
I think it just kept eating at me, because I can assure you that I never set out to be a businesswoman. That was never my intent. It's kind of worked out that way, but I'm such a hands-on people person that, you know, I have my own set of patients and I won't give them up.
That's what I was asking, yeah. I mean, here you manage, and I imagine you have a large number of nursing employees that are nurses, correct?
Yes,
Are they
yes.
skilled as you?
Yes.
Have
I
they been-
have many nurses that were in home health for years or in hospice for years, and those nurses in particular are ideal.
a large number of them RNs?
Yes, we have RNs and we have LPNs here, LVNs in Texas. We have a great group, and you know, if they just don't seem to make the fit somehow, it's pretty quick to see that. But most of the people that we get have such a background that they're drawn to it, and they
It's a calling.
Yes, it is. We have nurses that just seem to be that other family member that's missing.
Let me interject. Almost like a Florence Nightingale.
It's great. That's perfect, yes. It's very much that way. They have a heart for it. I've seen so many people go above and beyond what you could even imagine. It's pretty phenomenal. I hear stories, you know, on a daily basis from my nurses that just almost bring me to tears.
Can you relate one that it doesn't have to do with a particular person, but it was a story that you had heard that would touch somebody's heart, or would say, oh, if that occurred to them, it could occur to me? Is there
Sure.
something?
Let's see. There's so many. We have a nurse whom, she actually had a patient who's a retired nurse and a chronic illness patient, many disease processes going on, and pretty much confined to an electric scooter wheelchair. Didn't have any funds to get it fixed. It's half worn out. She could kind of evaluate and see why it wasn't sitting straight. It was sitting sideways. She did all this, putting together this puzzle of what's going on with this lady, and this was just one small portion.
This was your nurse assessing.
Just one small portion of it, and managed to get the resources outside of cash payment, but finding community resources to try and help this woman get what she needed, so she has a working scooter so that she can get around. She couldn't get around otherwise. And because of that, she was actually establishing a wound because she couldn't reposition without this thing leaning her to one side.
Sure.
These are things people don't really think about unless you're sitting on that scooter,
Right.
unless you've been trained to think about those things.
So your nurse assisted her in becoming more mobile,
Sure.
and possibly helping get that wound addressed.
Sure.
And making
Before it got worse.
Yes. All right. See, ladies and gentlemen, this is the thing. It's the difference in having a nurse who cares and someone that just walks in and says, hey, how you doing? How do you feel? Okay, everything fine? All right, and I'm out of here. Even though that might be what you're getting, what you need is someone to come in and continue that rapport that says, hello, tell me how you feel, and sit and talk for a few minutes. By the way, do you know the average doctor visit in minutes?
Oh, it's much shorter than it used to be.
7 minutes.
And that's probably a stretch for
Oh
some.
yeah, for some, 7 minutes.
Yeah.
But your nurses can go in there and possibly extend that amount of time
Absolutely.
in dealing with their patients.
Oh, they
correct?
spend so much more time than any of the doctors would ever spend.
And they do understand scripts, the
Sure.
medications, so it's not like they're coming in and they're having to go, oh, wait a minute, I'm not familiar with this, let me call somebody, right?
Yes. They also catch occasionally where one has been written incorrectly.
Oh, really?
And so, yes, I've had the experience even of getting to a patient's house and they've gotten prescriptions filled and it told them, I believe it read to inhale it. And it was a nose spray. It wasn't something to spray, it was something to inhale by mouth. And they'd just written things wrong. Well, she was not real highly educated and was so confused. And just sorting out some of those things for some people, and getting the pharmacy to take this medicine back that they
Oh my
didn't
gosh.
prescribe
That's
correctly.
a whole nother deal.
Right, and she had been round and round on the phone and they wouldn't do it. And so I got on the phone and we took care of that. So those are some of the little things you run into.
All right. So let's sum up. Proactive nursing solutions, going on 6 years, serving Shreveport, Bossier, satellite offices over there in Texas and Florida, and helping those people that are needing professional nursing services assess everything. And so what's the phone number to call?
Our local phone number is 318-674-9001.
318-674-9001.
Mm-hmm.
And the URL, the website again?
It's www.proactivenursingsolutions.com. You can also find us on Facebook. We do have a Facebook page.
Under what, Proactive?
Proactive Nursing Solutions. Not hard to find.
No, and more than anything, you're very, open to someone calling, getting information, correct?
Oh, sure. They can also email us.
Oh, and your email is?
Jennifer@proactivenursingsolutions.com.
And that's with 2 N's?
Yes.
JENNIFER at proactivenursingsolutions.com. That's the email. You've got about, say, 30 seconds. It's your time. What's the final takeaway you want people to remember?
We're able to tailor-make packages of whatever the needs are. We don't do one thing and say, this is how we do it. We make it available to people depending on what they need.
Cost efficient.
Cost efficient and tailored to what they need. We're not going to give them services that they don't need, that they can't benefit from.
And you see, that's what we as citizens, as Americans, that's what we're all asking for. What do we need? Not what are you going to just give us arbitrarily. Proactive Nursing Solutions, Ms. Jennifer Kimball, she's the CEO, she's the lady that founded it, and she still comes to work with a passion every day for helping others. And thank you, Jennifer, for being here today.
Thank you for having me.
And then the next time, you never know who's going to be sitting in the guest chair here at Comcast Citywide TV. I'm Tom Pace, again, the host of the Talk of the Town on The Promise, 90.7 FM, every Monday through Friday, 5 to 6. And just don't be a stranger. You'll see us again on A Conversation With. God bless. Have a great day.